Every 40 seconds, someone in America has a heart attack. That's about 805,000 people every year. And here's what keeps me up at night. Many of those people had warning signs, hours before, sometimes days before. Signs their body was sending them, practically screaming at them that something was wrong. But they didn't recognize them. They thought it was indigestion. They thought it was stress. They thought it was a pulled muscle. They went to bed thinking they'd feel better in the morning. Some of them didn't wake up. I'm not telling you this to frighten you. I'm telling you this because knowledge saves lives. And by the end of this video, you're going to know exactly what warning signs to watch for, including several that most people have never heard of. Here's something that might surprise you. The classic Hollywood heart attack, where someone clutches their chest and collapses, happens, but it's not the only way heart attacks present. In fact, for women, for diabetics, and for adults over 65, the symptoms are often completely different. And if you don't know what to look for, you might dismiss the very warnings that could save your life. So, in the next several minutes, I'm going to walk you through the classic warning signs everyone should know, the atypical symptoms that get missed, especially in women and older adults, what to do in the first 5 minutes if you think you're having a heart attack, and critically, what not to do, because some common reactions can make things worse. If you're over 60, or if you love someone over 60, this information could genuinely save a life, so please stay with me until the end. And if you find this helpful, I'd appreciate if you'd share it with someone you care about. This is the kind of information that needs to reach as many people as possible. Let's start with what's actually happening inside your body during a heart attack. Before we get to the warning signs, I want you to understand what a heart attack actually is, because when you understand the mechanism, the symptoms make much more sense. Your heart is a muscle. Like any muscle, it needs blood supply to function. That blood supply comes through your coronary arteries, the blood vessels that wrap around your heart and feed it oxygen and nutrients. A heart attack happens when one of those coronary arteries becomes blocked. Usually, this is because of a buildup of plaque. That's a fatty, waxy substance that accumulates over years. Sometimes a piece of that plaque ruptures, a blood clot forms on top of it, and suddenly the artery is blocked. When blood can't get through, the heart muscle downstream from that blockage starts to starve. Without oxygen, it begins to die. And here's the critical part. Time matters enormously. Every minute that passes without blood flow means more heart muscle dies. The phrase cardiologists use is "time is muscle." Modern medicine has incredible tools to reopen blocked arteries. There are clot-busting medications, there are procedures where doctors thread a catheter through your blood vessels and physically open the blockage. These treatments save lives and prevent disability every single day, but they only work if you get to the hospital in time. This is why recognizing symptoms early isn't just helpful, it's life or death. According to research from the American Heart Association, patients who receive treatment within the first hour of symptoms have significantly better outcomes than those who wait longer. Every 30 minutes delay in treatment increases the risk of death by approximately 7.5%. Let me say that again. Every 30 minutes you wait increases your risk of dying by nearly 8%. This is why I'm making this video, because the difference between recognizing symptoms and dismissing them can be measured in survival rates. Now, let's talk about what those symptoms actually look like. Let's start with the classic warning signs. These are the symptoms that most people have heard about, and they're common for good reason. Classic sign number 1, chest discomfort. The most common heart attack symptom is chest discomfort, but here's what most people get wrong. It doesn't always feel like pain. People describe it in many different ways. Pressure, like something heavy sitting on your chest. Squeezing, like your chest is being compressed. Fullness, like uncomfortable bloating in your chest. Aching, a deep discomfort that won't go away. Some people do describe it as pain, but many don't use that word at all. They say it feels uncomfortable or strange or wrong. The sensation typically occurs in the center or left side of your chest. It can last for several minutes, or it can come and go, disappearing and then returning. Here's something important. The intensity varies. Some people have severe, unmistakable chest discomfort. Others have mild symptoms that they dismiss as heartburn or muscle strain. If you're feeling any unusual sensation in your chest that persists or keeps coming back, especially if it's accompanied by any of the other symptoms I'm about to describe, don't talk yourself out of it. Take it seriously. Classic sign number 2, arm discomfort. The second classic symptom is pain or discomfort that spreads to the arm, usually the left arm, though it can affect both arms or just the right arm. This happens because of something called referred pain. The nerves from your heart and the nerves from your arm share pathways to your brain. So when your heart is in distress, your brain sometimes interprets those signals as coming from your arm. The sensation might feel like aching, heaviness, tingling, or numbness. Some people describe it as weakness in the arm or a feeling like the arm has fallen asleep.
Classic sign number 3, shortness of breath. Difficulty breathing or feeling like you can't catch your breath is another common heart attack sign. This can happen with or without chest discomfort. When your heart isn't pumping efficiently, fluid can back up into your lungs, making breathing difficult. Or your body may simply not be getting enough oxygen because your heart can't pump adequately. Pay attention if you become breathless during activities that normally don't wind you. Walking upstairs you've climbed 1,000 times, walking to the mailbox, even just sitting still. Classic sign number 4, cold sweat. Breaking into a cold sweat for no obvious reason is a warning sign that many people don't connect to their heart. This isn't the same as sweating because you're hot or because you've been exercising. This is sudden sweating while you're at rest, often described as clammy skin or drenching sweats that come out of nowhere. It happens because your body is in distress and your nervous system is responding. Classic sign number 5, nausea. Nausea, sometimes with vomiting, can accompany a heart attack. Many people mistake this for food poisoning or a stomach bug. The connection isn't obvious, which is why it gets missed. Your heart and your digestive system share nerve pathways, so your heart distress can trigger digestive symptoms. If you're feeling nauseated along with any other symptoms on this list, don't assume it's something you ate. Now, these 5 symptoms are the ones most commonly discussed, and if you have the classic presentation, chest discomfort radiating to the left arm with shortness of breath and sweating, most people recognize that as a potential heart attack. But here's where it gets complicated. Many heart attacks don't look like this at all. Now we get to the symptoms that save lives when you know them, because they're the ones that get missed. These atypical symptoms are particularly common in 3 groups: women, adults over 65, and people with diabetes. If you fall into any of those categories, please pay close attention. Atypical sign number 1, jaw, neck, or back pain. Pain or discomfort in the jaw, neck, or back can be a heart attack warning sign, particularly in women. This is another example of referred pain. The nerves are cross-wired, so your brain interprets distress from your heart as pain in these areas. People describe it as aching in the jaw, sometimes mistaken for a dental problem, pain in the neck that feels like muscle strain, discomfort between the shoulder blades, upper back pain that came on suddenly. A woman I read about in the medical literature went to her dentist 3 times for jaw pain before anyone considered her heart. By the time she was correctly diagnosed, she'd had significant heart damage. If you have unexplained pain in your jaw, neck, or upper back, especially if it comes with any other symptoms, consider your heart. Atypical sign number 2, extreme fatigue. Unusual, overwhelming fatigue can precede a heart attack by days or even weeks, particularly in women. This isn't ordinary tiredness. People describe it as exhaustion that isn't relieved by rest, feeling like you can't do simple activities that were easy before. weakness that seems disproportionate to what you've been doing, a profound sense that something is wrong. Research published in the journal Circulation found that 71% of women who had heart attacks reported unusual fatigue in the weeks before their event. 71%. Yet fatigue is so common and so easily attributed to other causes that it's rarely recognized as a cardiac warning sign. If you're experiencing unusual, unexplained fatigue, especially if it's getting progressively worse, mention it to your doctor. Atypical sign number 3, indigestion or heartburn. This one is tricky because real indigestion and real heartburn are extremely common, but heart events can mimic digestive problems closely enough that even doctors sometimes miss them initially. Heart-related indigestion tends to come on suddenly without an obvious dietary trigger, not respond to antacids the way regular heartburn does, be accompanied by other subtle symptoms, and feel somehow different from your usual digestive discomfort. One study found that patients who later discovered they'd had a heart attack commonly attributed their symptoms to acid reflux or something they ate. I'm not saying every case of heartburn is a heart attack, that would be absurd. But if you're having digestive symptoms that seem unusual, don't respond to treatment, or come with other warning signs, consider the possibility. Atypical sign number 4, dizziness or lightheadedness. Feeling dizzy, lightheaded, or faint can indicate your heart isn't pumping enough blood to your brain. Some people describe this as feeling off balance, a sense that they might pass out, the room seeming to spin slightly, feeling woozy or not right. If dizziness comes on suddenly and is accompanied by chest discomfort, shortness of breath, or any other symptoms, take it seriously.
Atypical sign number 5, throat tightness. A feeling of tightness, choking, or discomfort in the throat can be a heart attack symptom that people dismiss as allergies, anxiety, or a cold coming on. The sensation might feel like something is stuck in your throat, or your throat is being squeezed, difficulty swallowing, or a lump in the throat that won't go away. Atypical sign number 6, general sense of dread. This one is hard to quantify, but it's real. Many heart attack survivors describe a sudden, inexplicable feeling that something terrible was happening. Doctors call this sense of impending doom. Your body knows it's in crisis, even if you can't point to a specific symptom. If you suddenly feel profoundly anxious, panicky, or certain that something is very wrong, don't dismiss it as your imagination. Now, here's what I want you to understand about atypical symptoms. You don't need to have all of them. You don't even need to have several. Some people have just 1 or 2 warning signs. The key is recognizing when something is unusual for your body. You know what normal feels like for you. If something feels wrong, especially if it's persistent, if it came on suddenly, or if it's getting worse, trust your instincts. More people survive heart attacks because they listened to that inner voice than because they ignored it. I need to spend a moment on 2 groups that face additional challenges in recognizing heart attacks: people with diabetes and adults over 65. If you fall into either category, this section is especially for you. Diabetes and heart attack symptoms. Diabetes can affect the nerves throughout your body, including the nerves that transmit pain signals from your heart. This means people with diabetes may have what's called a silent heart attack, where typical symptoms are muted or absent entirely. Research published in the journal Diabetes Care found that people with diabetes are more likely to have atypical symptoms and less likely to experience the classic chest pain. They might have only mild discomfort, just fatigue and weakness, primarily digestive symptoms, or minimal symptoms at all. If you have diabetes and you feel unwell in a way that's hard to explain, if your blood sugar is behaving unusually, or if you just have a sense that something is wrong, don't wait for dramatic symptoms. They may not come. Age and heart attack symptoms. Similarly, adults over 65 are more likely to have atypical presentations. Studies show that older adults more commonly experience shortness of breath as the primary symptom, confusion or disorientation, fainting or near fainting, general weakness, less pronounced chest discomfort. There's also a tendency in older adults to attribute symptoms to aging. I'm just getting old. This is normal for my age. I don't want to bother anyone. Let me be clear. These symptoms are not normal at any age, and you are never a bother when your heart might be at risk. I'd rather you go to the emergency room and find out it was indigestion than stay home and have a preventable tragedy. Emergency rooms see people every day who turn out to be fine. That's a good outcome. That's the system working correctly. Okay, now the most important part. What do you actually do if you think you or someone else might be having a heart attack? The first 5 minutes are critical. Here's exactly what to do. Step 1. Call 911 immediately. Do not call your doctor's office first. Do not call a family member first. Do not look up your symptoms online. Call 911. Say clearly, "I think I'm having a heart attack," or "This person is having a heart attack." The dispatcher will send emergency medical services and can give you instructions while you wait. Here's why calling 911 is better than having someone drive you to the hospital. First, paramedics can begin treatment immediately. They carry medications and equipment that can be life-saving. Treatment starts the moment they arrive, not when you reach the hospital. Second, they can transmit your heart rhythm to the hospital. The cardiac team can be assembled and ready by the time you arrive, saving precious minutes. Third, if something goes wrong on the way to the hospital, you're with trained professionals who can respond. In a private car, you're not. Step 2, chew an aspirin if not allergic. If you're not allergic to aspirin and you have access to regular aspirin, chew 1 adult aspirin, 325 milligrams, or 4 low-dose aspirins, 81 milligrams each. Chewing is important because it gets the aspirin into your bloodstream faster than swallowing it whole. Aspirin helps by making your blood less likely to clot. It can reduce the damage happening in your heart while you wait for emergency treatment. However, if you're allergic to aspirin, if you've been told not to take aspirin, or if you're not sure, skip this step. Don't delay calling 911 to look for aspirin. Step 3, unlock your door. If you're alone, unlock your front door so paramedics can get in if you lose consciousness. If possible, turn on a light. If you have pets that might interfere, try to secure them. Step 4, sit or lie down. Find a comfortable position, usually sitting upright or slightly reclined, and stay calm. Try to take slow breaths. Do not lie flat if you're having difficulty breathing. Semi-upright is usually more comfortable. Step 5. Do not drive yourself. I cannot emphasize this enough. Do not drive yourself to the hospital. If you lose consciousness behind the wheel, you could kill yourself and others. Wait for the ambulance. If someone else is with you, they can drive you if the ambulance is more than 10-15 minutes away and you're in a remote area. But calling 911 first is still critical. Step 6. Stay on the phone with 911. The dispatcher can monitor your condition and give instructions. They can tell you if you should take aspirin. They can coach you through anxiety. And if something changes, they can update the paramedics. Now, here's what not to do. Don't wait to see if it gets better. Time is muscle. Every minute counts. Don't convince yourself it's nothing. If you're wrong about having a heart attack, the worst case is some embarrassment and a hospital bill. If you're wrong about not having a heart attack, the worst case is death. Don't worry about being a burden. This is literally what emergency services exist for. Don't take someone else's prescription medication. Unless you've been specifically instructed by a doctor, stick to aspirin only. Don't eat or drink anything besides water and aspirin. If you need surgery, having food in your stomach creates complications. Let me take a moment to talk about what happens after. If you or a loved one survives a heart attack, first and foremost, that's wonderful news. Modern medicine is remarkable, and many people recover fully and go on to live many more years. Here's what typically happens. In the hospital, doctors will determine the extent of the heart attack and treat the blockage. This might involve medications to dissolve clots or prevent new ones, a procedure called angioplasty, where a small balloon opens the blocked artery, a stent, a tiny mesh tube that keeps the artery open, sometimes bypass surgery, where blood flow is rerouted around blocked arteries. After the acute treatment, you'll likely go through cardiac rehabilitation, a program of supervised exercise, education about lifestyle changes, and support. Many heart attack survivors make significant recoveries, but it requires following medical advice, taking prescribed medications, attending follow-up appointments, and making lifestyle adjustments. The important thing to know is having one heart attack increases your risk of having another, but with proper treatment and lifestyle changes, that risk can be significantly reduced. This is why recognizing symptoms early matters so much. Patients who get early treatment have less heart damage and better long-term outcomes. Before we wrap up, let's briefly talk about reducing your risk in the first place. While this video is about recognizing symptoms, prevention is always better than treatment. Risk factors for heart attack include high blood pressure, high cholesterol, diabetes, smoking, obesity, physical inactivity, family history of heart disease, and age. Some of these you can't change, like age and family history, but many you can influence through working with your doctor to manage blood pressure, cholesterol, and blood sugar, not smoking, it's never too late to quit. Regular physical activity, even walking, makes a difference. A heart-healthy diet, maintaining a healthy weight, managing stress, and taking prescribed medications as directed. If you have multiple risk factors, talk to your doctor about your overall cardiovascular risk. They can help you develop a plan that makes sense for your situation. Let me leave you with this. The information in this video could save your life. It could save the life of someone you love, but only if you act on it. Here's what I want you to do. First, remember the warning signs, both the classic ones and the atypical ones. Consider writing them down and keeping the list somewhere accessible. Second, have a plan. Know where the nearest hospital is, keep your phone charged and accessible. If you live alone, consider a medical alert system. Third, share this information. Tell your spouse, tell your children, tell your friends. The more people who know these warning signs, the more lives will be saved. Fourth, know your risk factors. Talk to your doctor about your heart health. Get your blood pressure and cholesterol checked. Knowledge is power. And fifth, trust your instincts. If something feels wrong, if your body is telling you something is off, listen to it. Don't let embarrassment or inconvenience stop you from seeking help. You matter. Your life matters. The people who love you want you around for as long as possible. If this video was helpful, please share it with someone who needs to see it, and subscribe to this channel for more health information that could make a real difference in your life. In upcoming videos, we'll cover more topics that matter for your health, including how to understand your blood pressure numbers, recognize stroke symptoms, and have better conversations with your doctor. Thank you for watching. Take care of yourself and take care of each other.